Hello, I'm Ina Sanjana from Shimadzu Corporation. In this webinar, I'm going to introduce trends and solutions related to data integrity. This talk is divided into 4 topics. First, we will discuss data reliability regulations issued over the years to grasp the context of the current situation. Next, we will look at guidelines for computerized systems, that is, necessary instruments for data integrity, such as those provided by Shimadzu. Here we will discuss computerized systems in relation to Annex 11 of the PICS GMP guidelines. Then we will look at warnings from the Japanese and US authorities with regards to quality testing of medical devices. Finally, we'll discuss other points to bear in mind when it comes to data integrity with reference to these kinds of warnings from authorities. So let's begin with an overview of regulations related to data reliability over the years. This table shows guidance issued for pharmaceuticals. First, the basic GMP, or Good Manufacturing Practices, in the US were issued in 1963. Companies manufacturing pharmaceuticals within the US or exporting pharmaceuticals to the US are following these practices. Of course, in the R&D stages, they will need to follow the appropriate good laboratory practices and good clinical practices. Meanwhile, Japan's GMP was issued in 1974, and those for the EU in 1992. In 1997 came the US FDA's 21 CFR Part 11, known simply as Part 11, related to electronic data handled by computerized systems such as analytical instruments. This is a set of requirements to ensure that electronic data is as reliable as data recorded on paper. CFR stands for Code of Federal Regulations of Laws of the USA. 21 refers to Title 21, the section of these regulations reserved for the FDA. Part 11 is the 11th rule of Title 21 and is a federal law in the US. Since 2015, each country's regulatory authorities have issued guidance on data integrity. The MHRA in the UK was the first authority in the world to issue DI guidance in the GMP field. Since then, the WHO, the PICS, and the US FDA have released their own guidelines on DI, and the UK's MHRA expanded its scope from GMP to GXP in 2018. Keeping this history in mind, let's move on to the current state of data integrity regulations. Next, we will look at guidelines for computerized systems, that is, analytical instruments, in relation to Annex 11 of the PICS GMP guidelines. As we have just discussed, pharmaceutical companies should comply with the GMP regulations of each country. But the PICS GMP guidelines are also important because in a sense they constitute a global standard. Authorities from 49 countries around the world have joined the PICS, including the US FDA, European authorities, and Japanese authorities. GMP inspections are therefore being improved technically and becoming more prevalent internationally. Member countries also exchange information, for example relating to the GMP inspections. The GMP guidelines issued by the PICS can therefore be used as a reference for surveys in each country. To gain a picture of data integrity, we need to understand and respond to the requirements of the PICS GMP guidelines. These guidelines consist of Part 1, a main GMP section, Part 2, a GMP for active pharmaceutical ingredients, and several annexes. Today we will introduce Annex 11, which is about computerized systems. Here we have the contents of Annex 11, a section about computerized systems. The principles are presented first, followed by 17 chapters with detailed requirements. For example, the 4th chapter contains validation requirements. The PICS GMP guidelines require that computerized systems be validated and also meet requirements for data handling and security. The requirements for this computerized system validation are also contained in the US FDA's Part 11. Each requirement, including security, storing and auditing of data, are also shown here. Now I would like to highlight 4 key requirements for data reliability. The first requirement is data protection. This is shown in section 7.1, which states, data should be protected from damage by physical and electronic means. No specific method is given, but data must be protected both physically and electronically in some way. How can you physically protect your data? For example, if the system includes a computer, the data is stored on the hard drive. If the hard drive fails, the data will not be preserved. To prevent this, 2 hard drives can be installed on the PC, and the same data is always recorded on both. Even if one hard drive fails, the data on the other can be used. and after the broken drive is repaired, data is written to both hard drives again. Of course, if both are damaged at the same time, the data will be lost. However, since the probability of both drives failing at the same time is multiplied by the failure rate of each drive, the risk of this happening is very small. It can seem labor-intensive to always record data onto two separate hard drives, and there may be a fear that the user will forget to do so. However, there is technology that allows data to be automatically recorded to both drives, providing a simple way for users to protect their data physically. In recent years, our company has been offering PCs with two hard drives for use together with analytical instruments. And how can we protect data from damage electronically? If the data is stored directly in a Windows folder, anyone can accidentally change or delete the data if they can log on to the computer. The data is not protected. On the other hand, by managing data using a database, etc., you can avoid deleting data by mistake. This is just one example of how to protect your data electronically. The second requirement is to back up data. As shown in the slide, regular backups of all relevant data should be done. By protecting our data according to the first requirement, we reduce the risk of losing data, but the risk is never zero. Therefore, we should also back up all essential data. The third requirement relates to audit trails, that is, a record of changes to the data. It is stated that consideration should be given, based on the risk assessment, to building into the system the creation of a record of all GMP-relevant changes and deletions. In general, an audit trail allows you to record changes by hand, such as recording changes to data in a logbook. However, it is very difficult to ensure that the history of changes in the logbook is correct and error-free. For example, if a user changes a value from 1 to 2 and tries to record it in a logbook, they may get an emergency call, leave the room for an hour, then come back an hour later and forget to record the change. They might also mistakenly write that they changed the value from 1 to 2, but actually change it from 1 to 3, for example. To ensure that the contents of the logbook are correct, there must be other measures taken, such as, for example, a third party checking the contents in person or via a camera. Therefore, many recent systems, including our company's analytical instruments, have an audit trail function included. The wording of this requirement, building into the system, indicates that such a system should be utilized. In any case, the audit trail should be correct and complete. The fourth requirement is about access rights. It states that physical and/or logical controls should be in place to restrict access to computerized systems to authorized persons. IDs and passwords are often used to manage access, but this in itself is not enough. Access rights should also be allocated depending on each user's responsibilities. For example, staff whose main role is routine analysis via predetermined methods should have their access restricted to prevent a reanalysis, which may have a large effect on results. On the other hand, if there is a problem with the data, a manager may have to access and analyze the data. Permission to access or analyze data should therefore be managed for each user. These four basic requirements, that is, data protection, backup, audit trails, and access controls, are necessary to ensure data reliability. They are essentially the same as the requirements detailed in the US Part 11 and Japanese ERES guidance. Now I would like to introduce some real-life examples of warnings issued about quality testing. Here we'll look at examples from the Japanese authorities and the US FDA. First, let's look at real-life examples from Japan. As you know, the Japanese authorities do not generally make public the recommendations that come up in their GMP inspections. In the case of a serious accident or an incident that appears in the news, the recommendation will be made public, but this is not usually the case. The following examples are based on presentations given by PMDA and other Japanese authorities at our company. The examples presented here are for labs that conduct quality testing. These are cases where the system security settings or user rights were not appropriate. For example, it is not clear which staff have what access rights, or the person responsible for carrying out testing had administrative privileges. System administrators typically have access rights to manipulate data, such as moving or deleting data, so that if the person testing has administrative privileges, they can delete any adverse results from the trial. The group leader who performed the measurement task had the authority to edit the method, as described in the access control section of the PICS GMP guidelines, indicates that unnecessary authority was given to the person in charge, and in this case there is a risk that the person may manipulate data by mistake and alter testing methods. Other problems with security settings include all QC lab members have the right to delete data, and the password was not properly managed. This slide shows cases of inappropriate data reanalysis. As you know, in chromatography systems such as LC and GC, reanalysis, especially manual peak processing, has a direct and significant impact on the results. In some cases, it's possible to deliberately manipulate a failed test so that it passes. The authorities point out that in one case, by unauthorized reanalysis and deliberate manipulation of the peaks, they failed to identify the cause and avoided retesting. This is an example of data falsification. In addition, when reanalysis is performed, approval from the manager must be obtained and procedures prepared. As you can see, the authorities also found cases where procedures and criteria for reanalysis were not defined. There was no procedure to provide a specific example for reanalysis, or manual waveform processing, that is, manipulation, was common. The last point is that the results of the reanalysis were accepted without confirmation of the validity by the manager. The manager should make a decision on whether or not to conduct a reanalysis, and when conducting reanalysis, it must be done according to the procedures determined in advance, and the validity of the results must be confirmed. Here are some problems that have been observed relating to audit trails. The first issue was that the procedure for checking the audit trail was not fixed. This led to the strong statement that if there is no written procedure, it is equivalent to not checking an audit trail. That is, it is not enough to keep an audit trail. Recently, it's required to have the audit trail checked and reviewed according to a set procedure. This is to ensure data reliability by checking for any mistakes during testing. As mentioned previously, some instruments have an automatic audit trail function, but in one case it was pointed out that this function was not used even though it was available. If equipment without an audit trail function is used, other procedures should be established to maintain an audit trail and preserve data reliability until such time as equipment with this function can be installed. Finally, in the last case, it was pointed out that the audit trail was not managed correctly. As we can see, careful management and review of the audit trail is required. Here we have examples where there were problems with documentation or management. In the first case, it was not possible to confirm whether the test was carried out according to procedures. This is related to the audit trail problems on the previous slide. In the next couple of cases, results are in doubt because documentation of the procedure itself is lacking. To demonstrate the reliability of the data, records for operating conditions, reanalysis, and so on should be kept and reviewed. All of the recommendations and guidance presented so far are from the Japanese authorities. In recent years, in order to ensure the reliability of data, many other countries and regions have given similar guidance. Now we'll take a look at real examples of warning letters from the United States FDA. The FDA issues these letters when there is a problem with GMP according to their inspection, ordering the company in question to improve their procedures. These letters are published online with identifying information such as the company name and details of which problems were identified, and can be viewed worldwide. The impact of such warning letters should not be underestimated. Here's the first example. The bullet points under warning letter are taken directly from the original letter. Phrases in red show the main problems pointed out by the FDA. The points in blue summarize these issues. This warning letter was issued on the 31st of March 2015, and the ID is 3201508. By searching for this ID on the FDA website, you can find this warning letter. By the way, if the warning letter was issued because there were violations of the FDA's GMP, this is also made clear. Here the notation 21 CFR 211.68b indicates Section 68, Part 211 of the 21 CFR. On a previous slide, we saw that 21 CFR is the part of the US law related to food and drugs. 211 is the US GMP, and Section 68 relates to equipment. So we can infer that there was a violation in terms of equipment management in the lab. The letter firstly points out that the deletion or modification of data cannot be controlled in the LC or GC systems. This is true for systems where the analysis data is stored directly in a Windows folder. In other words, the analysis data is not protected. The letter points out that analysts can delete data in the folder where the analysis results are stored. It also points out that there is no audit trail function. We can see that if there are no data protection or audit trail functions in the equipment, this may be pointed out in a warning letter, so we should use equipment which includes these functions. Here is the second example. Firstly, it was pointed out that all employees use the same username and password to access the UV, IR, HPLC, and GC instruments. In this case, it is not clear who logged on when and who has been using the system. There is no user management and everyone has the same permissions. This case is slightly different from the first warning letter. In the previous warning letter, there were no functions for protecting data, but in this case, the system has a function for user management. However, if you use the same ID and password for all users, it's the same as not having any such function. So this case study shows that no matter how many data protection or security features the system has, it doesn't mean anything if they are not utilized properly. This warning letter also points out that raw data is not backed up. These two warning letters show that data protection, audit trails, user management, and data backup requirements from the FDA are the same as those required by the PICS GMP guidelines mentioned earlier. Data protection, audit trails, user management, data backup, etc. have been required since the time of Part 11. So you may wonder, if these are all satisfied, will data reliability and integrity be ensured? Let's look at a third type of problem that is being pointed out recently. In this third example, there is a problem of retesting. As shown in the diagram, the results from the first few rounds were discarded because they did not meet criteria to pass the test. Eventually, results showing a pass were produced, and these were given as the only results. Although the data was not actively manipulated or falsified, this kind of retesting until a positive result is obtained is obviously against GMP. If a failing result is obtained, then it is acceptable to retest if the cause of the failure is found and recorded. For example, if there is a problem with the equipment or a mistake in procedure. In this case, the problem should be rectified and a new sample tested. However, in this case, the data was discarded and the sample was retested many times without finding and rectifying the problem. This is clearly against GMP, but has been found in a real-life case. Because of this retesting, a warning letter was issued. In this last warning letter example, data has been replaced or destroyed, as shown in the diagram. In this last warning letter example, data has been replaced or destroyed, as shown in the diagram. This is clearly data manipulation and not acceptable under GMP. Because of advances in IT, it has become easier to manipulate paper records. For example, paper records can be scanned into a file and edited on a PC, then reprinted. It will then be impossible to distinguish manipulated results from the original results. More than 20 years ago, when Part 11 was published, there were rules in place to ensure the same level of reliability for paper and electronic records, because electronic data was more easily altered. At present, electronic data cannot be altered if the requirements of Part 11 are satisfied. In fact, paper records are now easier to tamper with. Therefore, there is no GMP problem with using paper records, but it is important to ensure that they are consistent with the electronic data and not manipulated. In some cases, FDA inspections have asked how the lab ensures that paper records match stored electronic data. Looking at the FDA's warning letters, it's clear that in addition to inadequate responses to their requirements of Part 11, they are looking closely at testing itself and how it is carried out. In recent years, the FDA's concern with data integrity is testing. In this final section, we will look at how to deal with data integrity with reference to what we've learned about guidance and warning letters from the authorities. First of these 3 points is about the importance of data management. At the moment, there are a lot of labs utilizing paper records. We have to be sure to manage the electronic data these records are based on carefully. For example, if we are looking at weight data from electronic balances, all the values can be printed on paper, and this will comprise a complete record. This is sufficient for data reliability. However, in the case of an LC, the printed test data such as sample information, chromatogram peaks, and quantitative results will only be a small part of the overall data obtained in the analysis. If a small peak appears in the printed chromatogram, it's not possible to tell whether this is from noise or the presence of a compound just by looking at the paper copy. The user will have to open up the file on a PC and zoom in on the peak to check the retention time and peak shape accurately. Then they may be able to make a determination. So for instruments such as LCs, we have to keep electronic records and manage them in conjunction with our paper records. The second point relates to the first 2 FDA warning letters we discussed. These warning letters pointed out violations of Part 211.68b, which requires the proper management and operation of computers and equipment. As explained previously, this includes cases where data is not protected, there is no audit trail function, or it is not properly used, etc. It also relates to cases where users all have the same ID and password to access the system, and therefore have the same permissions to alter or delete data. In all these cases, data integrity is not ensured. So what should we do to ensure data integrity? This diagram shows measures that should be implemented in terms of equipment functions and daily operations. For example, looking at systems functions. In order to prevent deletion of data, you could manage it in a database and use software that only allows certain users the permission to access it. This reduces the risk of data manipulation. Using a system with an automatic audit trail function also contributes to data integrity. In addition, the system should be managed appropriately, for example, by giving each user their own login ID. Both equipment functions and appropriate management of these functions are needed to ensure data integrity. In fact, these are not requirements that have been introduced recently for data integrity. They're equivalent to the legal requirements for electronic records in Part 11 and Annex 11, which have been in place for over 20 years. One point to note is that when Part 11 and Annex 11 are referred to together, Annex 11 is not the PICS GMP Annex, but rather Annex 11 of the EU GMP. In fact, the GMP of PICS is basically the same as the GMP of the EU, and when the GMP of the EU is revised, PICS adopts it. Therefore, the PICS GMP guidelines introduced earlier are GMP, or legal requirements, in the EU. So, the measures outlined in this slide are necessary for data integrity. However, by themselves, they are not sufficient. This is the third point relating to data integrity. In the third and fourth warning letters that we discussed, it was pointed out that test records and procedures were not reliable. As we discussed, there were problems with retesting until the desired result was obtained. Elsewhere, paper records were altered or destroyed in clear violation of GMP. These are not problems with the storage of data, but rather with the procedures used to generate the data. Even if data is well managed after the tests, the analysis data itself is not reliable, so the whole workflow is judged as inadequate. Let's look at what measures we can take to prevent this situation. On the left-hand side of this diagram is the life cycle of data. Firstly, the data is created through tests or analysis. It may then be changed through reanalysis, etc. Once the data is verified, it's stored, and finally, after a certain cutoff date, it will be deleted. The last 4 steps of data management in blue should be controlled by system functions and daily operational procedures, as we've already outlined. However, this is not meaningful if the test data itself is unreliable. This diagram shows the flow of data through the system. In general, when generating data or conducting tests, the first step is to create the data. There should be a manual for conducting the test correctly. This test procedure should be validated according to GMP. The important point here is to check whether the tests have been carried out correctly, with no intentional or unintentional deviations from the set procedure. The system should also have functions to ensure that procedures are followed. Quality assurance should periodically check for any issues in daily procedures that may compromise data reliability. If the data is generated according to a standard operational procedure in compliance with GMP, it's ready to be validated. As long as systems are in place to control the data management after the tests, the data will be reliable. Therefore, the key to data integrity compliance is how to check the data at the time of data generation, that is, to confirm that the test was performed correctly. Since the operation log and audit trail are recorded in the system, it's common to review and confirm the contents of the log and the audit trail to confirm that correct operations have been carried out. As mentioned in the case of the Japanese authorities, it should be possible to confirm that the test was conducted according to the written procedures. That is, the authorities are asking for confirmation of logs and audit trails. This slide shows an example of how to check that testing has been carried out correctly on an LC or GC. In most cases, chromatography tests are carried out in batches. A manager needs to check whether the tests have been carried out according to the established SOP, and this is done per batch. For example, they may print out a batch table of test sample information, i.e. batch sequence information, and verify that the analysis was performed on the correct samples and in the correct order. The audit trail and log are then printed to determine if there were any errors or if the analysis was unnecessarily interrupted, aborted, or restarted. If such an operation is found, the manager will check with the operator. If the action was appropriate, there's no problem, but if the action did not follow procedure, the batch should be retested. The manager will also print information about the methods to verify that the analysis conditions were appropriate. The analysis results report should verify that the results are correct. The manager has to perform these tasks in batches. Putting this into practice, you may find that it takes a long time, and sometimes incorrect information is printed out. For example, if you mistakenly select the wrong day's data to review, the review process becomes meaningless. These kind of procedures can seem laborious, but selecting, printing, and reviewing the necessary information can improve the reliability of testing work. Here we briefly introduce Shimadzu's LabSolutions CS system, which can increase the efficiency of data integrity implementation. CS stands for client server. Instruments such as LCs and GCs are connected in a network, and the data after analysis is centrally managed by the server. The client PC can access all the LCs and GCs in the lab remotely. Since all the analyzed data is also stored in the server, all LC and GC data can be reanalyzed from any client PC. In addition to LCs and GCs, LabSolutions CS has the ability to connect UV, FTIR, and other spectrometers. and other devices via a network, and the data and users can be managed centrally by a server. The server can also securely store data from non-Shimadzu devices. So this kind of LabSolutions CS system enables more efficient implementation of DI support. This is the Report Set feature of LabSolutions. The Report Set feature outputs a batch table or list of data as an analysis log by selecting a batch file or data file used in the analysis and clicking on menu options to create the report set. This allows you to see which samples have been analyzed. It also automatically extracts logs and audit trails related to selected batches and data from the system. This makes it easy to verify that the analysis operation was performed correctly. It also prints a report of the methods used in the analysis. Lastly, a normal analysis report is printed. A set of information about these selected batches and data, analysis logs, audit trails, method reports, and data reports is automatically extracted and securely stored in the system as PDFs. You can view, print, and review these PDFs from the Report Set feature. In this way, the Report Set feature enables you to quickly and accurately gather the information you need to streamline your review process. Here we come to the conclusion of this talk. The current trend in regulatory inspections is not simply to ensure the integrity of data through the function and operation of the system, but also to ensure the reliability of the entire operation. The website of the UK authority, MHRA, which published the world's first DI guidance, uses the term personnel integrity. It's difficult to be certain of people's actions and make them fully reliable. They say that we ought to trust but verify. In other words, we want to trust each other, but we need to verify it. Without access permissions, you can't manipulate systems and data, but the focus is on how to stop the malicious actions of people with legitimate authority and how to ensure reliability as a whole organization. We need to build business flows and procedures based on these factors. This final slide summarizes what is required by regulators in terms of data integrity. First, we need to ensure the reliability of the data itself. This includes protecting and securing data, providing an audit trail, and backing up. These are Part 11 and Annex 11 requirements. We also need to ensure the reliability of the procedures and overall workflow. For example, we need to check the validity of operations carried out during tests, that is, whether the wrong operation was performed, whether it was intentional, and even if it was a mistake. The judgments of results and the soundness of the organization as a whole are also under scrutiny by regulators. In addition to verifying data reliability, data integrity is ensured by focusing on the reliability of work procedures as a whole. Thank you for your attention.
Excellence in science. Shimadzu.